Thursday of next week, do your quiz, because I know you want to cook your turkey, have your family over. You don't want to think about quizzes, so I'll have it open for the whole week. Okay? Okie dokie. Let's get started. Now I'm going to go home too. Okay. So chapter 22 is basically talking about diseases, whether they be bacterial, viral, or even fungal of the respiratory system. We're talking about the upper respiratory system as well as the lower respiratory system. So we'll get into that right now in terms of where is what, okay? So let's quick to the chase, okay? So let's go to this figure here. This figure here simplifies the first three slides in terms of the respiratory system, right? Upper and lower. So basically, the upper respiratory system is everything basically from the pharynx on up. We will include the uvula. But basically everything from the pharynx all the way up to your nasal cavity, including the auditory tube, all of that is the upper respiratory system. Okay. Everything from basically the epiglottis on down is going to be the lower respiratory system. Now, whether it's upper or lower, your body does have some let's say some barriers against potential pathogens. For example, in the upper respiratory tract, your cells are lined with cilia. And basically, for example, in the nose, for example, you have hairs in the nose. Okay, basically, you're trying to filter out dust, particles, but more importantly, filter out some pathogens that may end up in the nasal cavity. Now, any pathogen that ends up in the nasal cavity, they're going to be swept down into your throat so that you swallow them and basically what? Digest them in your stomach. Makes sense? So that's in the upper respiratory tract. You actually have cells lined with cilia that take anything from the nose and basically push them on down to your throat and swallow them. Likewise, in the lower respiratory tract, you also have cells lined with cilia, correct? And their job is basically, I forgot to mention this. Along the lower respiratory tract is lined with mucus plus cells lined with the cilia. Now, if bacteria or viruses get trapped in the mucus in the lower respiratory tract, what happens is you have cilia that basically do this, right? They're basically moving the mucus up your trachea, right, with anything trapped in that mucus so that you basically end up doing what? Swallowing back down in your stomach, and you break down anything that was caught in the lower respiratory tract. Make sense? Also, in the lower respiratory tract, you have macrophage cells called alveolar macrophages, okay? They're basically in the alveoli. So if you remember back in A&P, okay, you go from the trachea down to your lungs, you have the bronchi, the bronchioles, and they end in what? The alveoli. That's where you actually do what? Gas exchange. Now within the alveoli, you actually have macrophages, and they're waiting for any potential pathogen that makes its way down there. Their job is to do what? To eat them, okay? So they're alveolar macrophages. That's another thing you have to protect you. Also, within the lower respiratory tract, you have secretory antibodies. And what would that be? IG what? Who's the secretory antibody? IG who? IgA. So IgA is going to be in the mucus, right? Saliva, anything that's secreted, right? Milk, for example, anything that's secreted, you will find IgA. So IgA is also in what? Lower respiratory tract, because it's going to be in the mucus, okay? So those are some barriers you have against pathogens. Okie dokie. Now, in terms of the normal microbiota in your respiratory system, the only normal microbiota that you'll find is going to be in the upper respiratory tract, okay? The lower respiratory tract should be azenic. Azenic means without bacteria, right? Without fungi, without viruses. So the lower respiratory tract should be sterile, okay? If there's anything down there, you're in big trouble, right? You're sick. But you have lots of bacteria in the upper respiratory tract, okay? I gave you some examples. So some normal bacteria that are really not pathogens are the diphtheroids. The diphtheroids, these are gram-positive bacteria. They are not pathogenic. The reason they're called diphtheroids, they look a lot like a bacterium called Corynebacterium diphtheria. Okay. That one is actually pathogenic. We'll talk about him today, okay? But diphtheroids, they're basically gram-positive bacteria. They are non-pathogenic. You can find them in the upper respiratory tract. They don't cause the disease. But these guys here, they are also a part of the normal microbiota, but they may be opportunistic pathogens, which means given the opportunity, they can make you sick. But here's the deal. They are already living with you, makes sense? So, and some of you, for example, you got Staph aureus in the upper respiratory tract. And as long as you're healthy, it won't cause a problem, okay? You also have a gram-negative bacterium called Haemophilus. We'll talk about Haemophilus today in terms of what he can cause, right? And also many different types of Streptococcus species. We'll talk about 2 of them today in terms of the diseases they cause, okay? So those 3 guys, they are a part of your normal flora where in the upper respiratory tract, and given the opportunity, they can do what? Make you sick, got it? Good. Well, let's get right into our diseases real quick. First one, so the first couple of diseases will be the upper respiratory tract. So the first, I say 10 diseases, upper respiratory tract, okay? We'll do bacteria first and then the viruses. First one up, streptococcal diseases, okay? Things like basically strep throat. So this slide is really talking about strep throat. So streptococcal respiratory disease. Basically, if you got strep throat, guess what? Your throat is what? Sore. You've got trouble swallowing. You have a fever. If you look at the back of your throat, it's probably what? Red. And you may see some pus back there, okay? So basically, red throat, sore, pus in the back, fever, you've got what? Strep throat. Okay? Now, if you let strep throat progress too long, it may develop into scarlet fever or rheumatic fever. That's if the disease progresses too long. Now, in scarlet fever, that's basically where you now develop a rash, literally. You develop a red rash all over your body, and even your tongue becomes strawberry red. So scarlet fever is basically a rash as a result of the bacterium that causes strep throat. Again, if you let the disease go too far, you may get rheumatic fever. Okay? Now, rheumatic fever is basically inflammation of the heart valves and the heart muscle. Now, if you don't get that fixed, it can lead to heart failure when you get older. That's when you let this disease get basically too far down. You don't treat it early enough, okay? So basically, if you think you have strep throat, get to a doctor, okay? You don't want it to go too long. You may get scarlet fever, which is basically a rash, but you may get rheumatic fever, right, which leads to heart damage. Okay. Now, strep throat is basically caused by a group A streptococci, that's Streptococcus pyogenes. Now, why am I telling you group A strep? Because I just told you there are many different kinds of Streptococcus species, and they're put into groups based on their antigens. Make sense? It's group A, B, C, okay? Now, the type of strep that causes strep throat is group A strep. It's also gamma hemolytic, which means if you put it on blood agar, it does what? It's going to completely lyse the blood on that blood agar plate. So basically, the bacterium that causes strep throat is strep A, and it's also gamma hemolytic. It has lots of virulence factors, meaning this is why it can make you sick. I'm not going to hold you to all these guys. Just know that it has many different factors that can make you sick. In particular, I will point out a couple. Like this guy right here. This hyaluronic acid capsule, basically focused on capsule. It has a capsule to what? Hide out from your immune system, right? That's why it has a capsule. Also, I will point out that pyrogenic toxin. Pyro means fire, literally, like pyromaniac. So pyrogenic toxins, these are the toxins that basically cause scarlet fever, like that rash you see, okay? So that toxin there, that pyrogenic toxin, causes the rash and scarlet fever. Anything else here? No. So basically the capsule is for hiding from the immune system, okay? That pyrogenic toxin causes the scarlet fever. Also what? Fever itself, right? Fever and also inflammation. So these are virulence factors in what? Streptococcus pyogenes. Makes sense? Because pyogenes means fire. Think of scarlet fever. Got it? Okay. Okay, so pathogenesis, basically, you end up with strep throat when either A, the normal flora are depleted, so you have lots of bacteria in this area here. If they're gone, that gives Streptococcus pyogenes a chance, right, to basically do its thing, because it's already there, right? But if there's other bacteria there, it has to compete with the other guys for nutrients. So if the normal flora are gone, it gives Strep pyogenes a chance to make you sick. Also, if the inoculum is large, so for whatever reason, you just inhaled a lot of droplets that contain strep pyogenes, well now you basically gave yourself a heavy dose of that guy, and you may end up with scarlet fever, strep throat, hopefully not scarlet fever. Or also, the adaptive immunity is impaired. Now, usually, for example, who gets strep throat more often? Think about it. Who?
Children.
Children. You know why? Because in children, their adaptive immunity is still, what, developing. Makes sense? It's developing. That's why children are the most susceptible to what strep throat. As an adult, you don't really see it anymore, right? Because why? Your adaptive immunity is really in high gear. It takes care of that guy. But if you're a child, that adaptive immunity is still developing, and that's why they end up usually getting what? Strep throat. Makes sense? Okay. Now, of course, usually, I'm going to say it right now, usually, if we're talking about either upper or lower respiratory diseases, right, usually it's spread by what? Respiratory droplets, okay? So I'm not going to say that every time. So usually you breathe in droplets that contain what? That pathogen, either a bacterium or a virus. Make sense? So most of these are basically inhaling in those droplets. Okay? It usually occurs most often in the winter and the spring. This is where usually most people are in crowded daycares or crowded classrooms, so that if someone coughs and someone's right there, they end up inhaling in those droplets, okay? Anything else? In terms of treatment, it is important to get an actual diagnosis if you think it's strep throat. So last class period, we're talking about vaccinations, right? And some people had questions about if you get vaccinated, does that lead to more antibiotic-resistant bacteria? I said no, right? Basically, it's the misuse or the overuse of antibiotics that gives you rise to what? More antibiotic-resistant bacteria. Makes sense? In other words, why am I telling you this? If you think you have strep throat, you need to get an accurate diagnosis. Makes sense? Because about 50% of all pharyngitis, basically sore throat cases, are basically viral. Makes sense? So just because you have sore throat does not mean you have strep throat, right? It just may be a viral case of a sore throat. So you really got to get to the doctor, get an actual diagnosis, and if it actually is strep, you do want to get on antibiotics. Like you do want that. Why? Because it can lead to what? Rheumatic fever if you don't treat it. So you want to treat it with antibiotics. But if it's viral, don't get on antibiotics, right? Because if you do, it makes no difference. If it's a virus, it's not going to do anything. And with added antibiotics, you're going to do what? Increase the chances of what? More antibiotic-resistant bacteria, because you're what? Doing overuse, right? Overuse is bad. Okie dokie. I'm not going to go through this. This is in your textbook. If you want to go through the things I just talked about, or you can see this poor kid's back throat is red. You see the pus back there? That's strep throat for sure. That is strep throat, okay? Red back throat, pus, with a fever, for example.
That's common.
Common in kids, yeah. Absolutely, in children. It is common. In babies, especially in daycare, and kids in school, it's real common. It's common. But not in adults, though, not in adults. Really in children. Okay, okay. Next one, diphtheria. Okay, and then most of you are like, who? You've heard of strep throat, right? Because you probably had it, or someone you knew had strep throat, but this one, you probably never knew anyone who had diphtheria, okay? All right, signs and symptoms. The key thing with diphtheria is the presence of a pseudomembrane. Now, diphtheria comes from the Greek word for leather. So the Greek word for leather is diphthera. So basically, take out the I there, and diphthera, without the I, diphthera is basically Greek for leather. It's talking about the pseudomembrane that is made when you're actually infected with this bacteria. Now, the pseudomembrane is bad because that pseudomembrane basically adheres to the back of your throat, your tonsils, for example, now, or the roof of your mouth. Now, if that pseudomembrane ends up in the back of your throat, I'll show you pictures, it can actually block your airway, which means you can die. Makes sense? You cannot breathe if you have a pseudomembrane covering the back of your throat. It literally restricts your airway, and that's how you pass away. All right? Now, the causative bacterium is Corynebacterium diphtheriae. Okay? So it causes what? Diphtheria. Now, it's bad because it has a diphtheria toxin, and that toxin basically kills cells. Now, that toxin kills the cells, and it actually causes the cells to form that pseudomembrane. So I'll show you a picture of it. Pseudomembrane is basically dead cells that come together, and they basically form in the back of your throat or the roof of your mouth, form your tonsils. Now, this picture, you really can't tell, right? This is in your textbook. You can't tell where that pseudomembrane is. You really can't tell. So I got another one for you. Can you now see where that pseudomembrane is?
Oh,
exactly.
cow.
You see that?
How do you get rid of that?
Surgically, literally. Surgically. Because if you try to rip it off, I mean, literally, you will take off the skin off the back of your throat. You have to have it surgically removed, literally. Because it's stuck back there, and it doesn't come off.
And they something you want to see on a blind date.
No. So surgically remove, okay? So basically, that is, yeah, you don't want to see that either. That is your pseudomembrane. So if you see that, that is really indicative of what? Diphtheria, makes sense? Caused by who? Corynebacterial diphtheriae. Now, if you don't get rid of that, okay, if that thing grows, you see what's going to happen, right?
Can't breathe.
You cannot breathe, and you will die from that. Now, you don't see in this country, right? Because why? Many of you are what? Vaccinated against this bacteria. If you got that DTaP vaccine, right? Diphtheria, tetanus pertussis, guess what? You're vaccinated against it. So we don't see it in this country. But in many poor nations who don't have that vaccine, children do get diphtheria, and they can die from it. So that's why you haven't heard of it, right? Because really in this country, who gets it, right? Most people are what? Vaccinated. Okay. So we have some protection from it. Okay. Now, we talked about this before. Corynebacterium diphtheriae, okay, it does that snapping division, makes the palisade arrangement. This is one way you can know for sure it's actually this. Minus the pseudomembrane. The pseudomembrane is a dead giveaway, but if you really want to be sure, you can do a gram stain, and you basically get these palisade arrangements. I don't know why they call this Chinese lettering. I think that's offensive. We don't have any Chinese people. So they call this Chinese lettering, right? I don't see how they call that. But the palisade arrangement is basically that side-by-side cell arrangement because those cells divide by snapping division and they remain connected to each other. That was like 5 chapters ago, right? Yeah, that was 5 chapters ago. Okey-dokey. Same difference, right? Respiratory droplets, how it's spread, or even by skin contact. Now, it's symptomatic, meaning you have symptoms if you're immunocompromised, right? Or you did not get the vaccine. Because if you're vaccinated, guess what? You don't have any issues. Now, I told you, right, how you diagnose it? That pseudomembrane is a dead giveaway in the back of your throat. You can treat it with antitoxins, right? Because really, it's because of that diphtheria toxin, that's why it makes those pseudomembranes. So you can have an antitoxin to take away the toxin itself, to neutralize the toxin, or basically antibiotics to kill the bacteria. But really, the most effective way to prevent it altogether, just get immunized against it. So your DTaP vaccine takes care of diphtheria. All right, next one, sinusitis in adults, otitis media in children, okay? All right. Now, basically, you probably had sinusitis before, right? You basically have pain where? In the sinuses. So you usually have buildup of pressure in your sinuses. Right, you go to the doctor, and the first thing they probably do is they start pressing here, right? They're pressing here, and while they're pressing in here, they want to know if it hurts. Right? And if they do that, and you're like, oh my gosh, it hurts, they know what? You got sinusitis, basically what inflammation of the sinuses, makes sense? That's why they're touching your face, okay? To rule out something else like an allergy, makes sense? That's why they're doing that. Because if this is not sore, you don't have this, right? You probably just have some allergy. That's why they're touching your face. Blah, blah, blah. Okay, otitis media, okay, basically ear infection, right? That's what it is. It's an ear infection, okay? Basically, you have severe pain in your ears. Basically, you have pus building up in the eardrum. Okay? You have a lot of pressure building up behind that eardrum, and that causes pain. Okay? Now, who are causing these guys? Okay, sinusitis in adults, otitis media in children, okay? A variety of upper respiratory microbiota, okay? Depends on who's available, okay? You have Haemophilus influenzae, you've got Staph aureus, even Staph pneumoniae. Any one of them can cause those diseases, okay? They basically gain access, because these guys are in the pharynx, okay? They're hanging out in the pharynx, and they basically get into the sinuses or into the eardrum, basically by either the auditory tube or the pharynx itself, okay? They just kind of crawl up there, got it? Okay. Now, in terms of how they're spread, I just mentioned that to you, okay? You don't get it from another person. You don't get it from droplets. Remember, these bacteria are already in you, okay? They're already there. They just kind of make their way into the wrong areas, okay? Now, as I mentioned before, sinusitis is more common in adults. Now, why is ear infection more common in children? Anyone know? Sort of.
Their auditory tube hasn't completely developed.
You're on Debbie is saying their auditory tube has not completely developed. You're on the right track. So
Because they put everything in their mouth.
they do. That's also true. So here's the deal. In adults, okay, how is your auditory tube oriented? Is it vertical or is it horizontal? It's vertical. It's vertical. Back up. Back up, right? Where's that little picture? This here is your auditory tube, right? It's vertical. And guess what? In children, it's actually horizontal. It's horizontal in children. It's horizontal. Which means, for example, if they get an infection in this middle ear area here, if they get an infection right in there, usually in adults, even if you got an infection there, any pus that's available drains out, right? See that? Any pus that builds up here actually drains out into your throat. But if you're a child, this tube is actually horizontal, makes sense? Which means any pus that builds up from inflammation stays there, makes sense? And all that pus leads to increased pressure behind that eardrum, makes sense? And that pressure causes pain. So if you've had children, you know when they do this, right? Because if they can't talk, they're holding their ear, right? Because their ear hurts. So if you have kids, or will have children, you know, right? When they're babies, if they're holding their little ear and they can't tell you my ear hurts, it's pressure in there. Take them to the doctor, right? They got an ear infection. All that pressure does hurt. It can also lead to hearing loss, which means they can have delayed speech. If you can't hear, you won't learn how to talk, makes sense? Now, if your child has multiple ear infections, you can get tubes placed into the eardrum to help with the drainage. Because you want to drain that pus out. That's all you want to do. Drain the pus so that you don't have all that buildup, the pressure behind the eardrum. Makes sense? Okay. All right, so kids, that tube is actually horizontal. And that's why they have multiple what? Ear infections. That's why. Hit it.
Is the reason why it just gets filled up with pus and stuff is because like all the bacteria just going into your ears, or like when you go swimming and you don't clean them out and stuff like that?
Well, the bacteria end up in this area here. They kind of make their way up here. And basically you have an infection there. It causes inflammation. You got pus. Basically pus is what? Well, how did I describe it earlier? Pus is like the remnants of a war. And pus, you've got dead bacterial cells, you've got dead macrophages. I mean, it's basically the result of a war.
No, that's saying like if you don't clean your ear.
That doesn't do anything. No, in children, their tube is horizontal. Also in children, their tube is more narrow. It's more narrow. So they have a narrow tube, but it's horizontal, which means any pus that is formed can't get out, which means increased pressure. And sometimes, if the pressure is high enough, the eardrum will burst. So if there's that much pressure, the eardrum will burst. And here's the deal. If the eardrum bursts, it will heal over time. It's not like it's permanently damaged. It will heal on its own. But if the pressure is too great, that will burst on. Okay, let's get back to our... Okay, so you can answer that question now, right? That's why ear infections, right? More common in children. But in adults, you end up with sinusitis, okay? Talk about that. Basically, how you diagnose that is described to you. If you are an adult, the physician will do this. Touch your face, right? If this is owie, 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 that's what sinusitis. If not, you got an allergy, okay? In children, all they do is look into their ears, right? If they see swollen eardrums, basically, they got an ear infection, okay? There is no way to prevent either one. You can't prevent either one. Why? Because those bacteria are already what? In the pharynx, right? They're already with you, okay? So you can't get rid of them. Okay, now let's talk about viral upper respiratory disease, and we're on to the viruses, okay? Common cold, everybody gets it, right? At least 1 or 2 a year, correct? All right. You already know the signs and symptoms, right? Sneezing, runny nose, cough, congestion, sore throat, malaise, basically feeling yucky all over, right? Feeling kind of yucky and sick, and also your cough. Here's the deal. You don't see a fever with this, okay? Do you see fever up here? If you have a cold, if you have a true cold, you do not have a fever. Here's the deal. If you have these symptoms with a fever, you'll probably have the flu. Makes sense? All right? So everything up here without a fever, you got a cold. All right. Now, there are many viruses that are able to cause common cold, at least 200 of them. That's why there's no vaccine against the common cold. Now, the more popular ones are basically the rhinoviruses. So that's the one I'm going to hold you to, right? The rhinoviruses cause the common cold. Okay. Other viruses too. So the adenoviruses, they can also cause your common cold. Now, basically, the cold viruses, they infect the upper respiratory tract because you only had chapter 13, right? It wasn't with me, but you had chapter 13, correct? And you understand that in order for a virus to make you sick, it has to do what? Before it replicates. So in order for a virus to make you sick, it has to do what?
Adhere.
Adhere, right? It has to adhere to your cells, make sense? That should be common knowledge at this point. So the common cold, it has basically adhesion factors that adhere to the upper respiratory tract only. Make sense? Only.
So there's specificity.
Exactly, literally. So the cold viruses, they have specificity for the upper respiratory tract. That's why everything is up here, right? Runny nose, cough, blah, blah, blah. It's all up in here. Nothing down here, right? Because the cold viruses can only attach to the upper respiratory tract. Make sense? Okay. I'm not going to spend time with here, but these little guys are really rhinoviruses, so let's keep moving. Blah, blah, blah. Now, these rhinoviruses are really ineffective. You're like, what does that even mean? It means that one particular rhinovirus can make somebody sick 50% of the time. So they're not effective viruses. They're not highly virulent, okay? They're not like HIV, for example, where if you get exposed to HIV, you pretty much will have it, okay? If you get exposed to a rhinovirus, you may or may not develop a common cold. So they're not all that effective. Well, you know how it's spread, right? Those droplets from coughing and sneezing. That's why we normally cover our sneezes, cover our coughs. We don't want to spread droplets. We don't want to do that. Now, phone mites, again, if you sneeze on the door, okay, you touch that door handle, you touch your eye, you got the cold, okay? Person-to-person contact, so whenever you shake someone's hand, wash your hands afterwards, literally. Or if you shake someone's hand, get their hand sanitizer out. I do it. I don't care. I shake your hand. After I'm done, I'm washing my hands. Because that's how you spread the cold or even the flu virus, right? On your hands. Also, you can self-inoculate yourself with that cold virus. So I talked about this before. You have the cold virus on your hand, and then you go touching your eye. Okay? You have now put the cold virus in the mucous membranes of your eye. That cold virus will basically travel down the tear duct and to the pharynx, and at that point, it will make you sick. That's why you really have to wash your hands, especially if you got a tendency to do what? Rub your eyeballs. You self-inoculate yourself with the cold virus. Same thing with the flu virus. Make sense? So wash your hands, right? So signs and symptoms, diagnostic, you know if you got the cold, okay? Now you can take this drug, but I've never, in my entire life, never heard of anybody taking an antiviral drug for the cold, because it usually resolves itself after about a week. Now sure, you may have that lingering cough for a while, but the other symptoms about a week. Then after that, 2 or 3 more weeks of that hacking cough. Alright? Now, what is the best way to prevent the cold? Wash your hands, okay? All the time. Don't be afraid. Wash your hands all the time. That's the best way to prevent your cold. Now, at this point, let's go on down to the lower respiratory tract, okay? Here's the deal. I said earlier that the lower respiratory tract should be what? Azenic, right? Which means it should be sterile. So anything, whether it's a virus, or a bacterium, or even a fungus, if they get down in there, you're in trouble, okay? You will be sick, all right? So that's not good. Let's talk about that. Let's talk about bacterial pneumonias, okay? Because pneumonia, which is basically inflammation of the lungs, it can be caused by bacteria, it can be caused by viruses, it can even be caused by fungi, okay? So let's focus on the bacterial pneumonias, okay? All right, so basically, your lungs are inflamed. Also, your alveoli and the bronchioles are filled with fluid. Okay. Let's see, blah, blah, blah. You can basically name your pneumonia based on the region or the organism that causes it. So, for example, I've got pneumococcal pneumonia versus mycoplasma pneumonia. So you're naming the pneumonia based on what? The bacterium that is causing it, okay? You can name them like nosocomial pneumonias, meaning you got it where? From the hospital, right? So you can name these pneumonias based on the causative agent the location of the pneumonia in your body to be like where in the lung or where you got it from, like nosocomial pneumonia, which are often deadly. Okay, I'll get into that in a minute. Okay, now bacterial pneumonias are the most serious ones, and they are the most frequent seen in adults. Let's first talk about pneumococcal pneumonia. You're like, pneumococcal? Who? Pneumococcal pneumonia is caused by Streptococcus pneumoniae. Okay? So pneumococcal is like an old school term to talk about Streptococcus pneumoniae because it causes pneumonia. All right? Now, what are some signs and symptoms? Okay? Short, rapid breathing. But more importantly, you have rust-colored sputum. Basically, this is blood in your sputum. Now, this is why, even though you don't like doing this, I'll tell you right now, if you end up coughing up some sputum, you should at least spit it out and see what it looks like. Why? Because you need to see, is it clear? Is it green? Is it yellow? Is there blood in it? This really helps the practitioner figure out what's wrong with you. Make sense? If you tend to cough up the sputum, but you end up swallowing back down, guess what? You never see what it looks like. I know, some people do that. So it's good to at least spit it out, right? To see what it looks like. See if there's blood in there, right? That could be indicative of pneumonia, got it? Okie dokie. Just spit it out and look at it. I told you about this guy, caused by Streptococcus pneumoniae, has some virulence factors, like adhesions, okay, and a capsule. Really has a capsule, which means it hides from your immune system. It also has a toxin called a pneumolysin. It's basically a cytotoxin. Basically, it kills cells. You all okay so far? I'm going to call y'all out. Y'all know you teach high school. I don't have a problem calling some of you out. If I think you're bored, I'm going to say, look here, so-and-so. You look bored. You may want to perk up, right? You know why I do that? To make sure you were listening to me, right? You know, I do kind of stuff like that, right? I don't care. If I embarrass you, you know what you did in high school, right? They call on you. Guess what? I know everybody's name. I really can't call on them, right? If they look like this bad down, I really can do that. In terms of pathogens and epidemiology, okay, you basically inhale the bacteria through respiratory droplets. That's how you acquire it. Okay? They actually replicate in your lungs, and they cause damage when they do that. It leads to pneumonia. Oh boy, in terms of how you can treat it, any type of antibiotic, in terms of whichever one your physician thinks is best, they'll put you on some antibiotic. Yes, Hattie.
The only way you can find out if they have like liquid in their lungs and stuff is by X-ray.
They can listen to your lungs, for example, literally. So whenever they put the stethoscope to your chest, they're listening for fluid in your lungs. That's exactly what they're doing. If they hear fluid in your lungs, they're going to say, that's not right. Because you should not have, fluid in your lungs. And at that point, they'll do subsequent testing, like they can look at your sputum. And if you have any bacterial or even fungal diseases in your lungs, they will be present in your sputum, literally. So they can take a sample of your sputum and look at it and see, are there bacteria in here? Are there fungal spores in here? That can be indicative of an infection in your lungs. But they usually look for fluid in your chest first, and then they go from there. Also, if you have blood in your sputum, they'll say, okay, something's not right. Because whenever you have blood in your sputum, that is bad. You got some infection way down in here. Okay? Okay. Actually, in terms of preventing, you can actually get vaccinated against this guy, pneumococcal. You can. So there is a vaccine against Streptococcus pneumoniae. You can get vaccinated against it. Here's the deal. Just because you get vaccinated against Strep pneumoniae doesn't mean you have immunity against the other types of bacterial pneumonias. Make sense? So keep that in mind. All right. Here's a little picture of Strep pneumoniae. Typically, it's a coccus, right? See how they're round shaped? It's a diplococcus. They normally form chains of two, and everything on the outside is basically their capsule. This is primarily why they are very pathogenic, because they have that capsule. Okay, here's the other type of bacterial pneumonia that I will focus on in lecture. There's other types, okay, but I'll focus on these two for you guys. It's basically caused by Mycoplasma pneumoniae. This is primary atypical, or basically mycoplasmal pneumonia, aka walking pneumonia. So have you ever heard of walking pneumonia? It's this right here. It's caused by Mycoplasma pneumoniae. The reason why it's called walking pneumonia, you have symptoms that are not severe enough to put you in the hospital. That's why it's called walking pneumonia. You basically feel well enough to go to school and so on and so forth. Now, walking pneumonia is really common in high school students. Sorry, Toby. So high school students and college students, they typically have more incidents of walking pneumonia. Okay. So what are some symptoms? Okay, fever, malaise, sore throat, excessive sweating caused by Mycoplasma pneumoniae. It has basically adhesion factors that allow it to bind to your cells. Now this guy is really spread by nasal secretion. So basically, you sneeze on your hand, right? You didn't really wash your hands, you start touching things. Or your nose is running, okay? You do this because you don't have a napkin or paper towel, and then you touch the door handle. So it's really spread by nasal secretions within people in close contact, like dormitories or classrooms, for example. So this is why it's really seen amongst college students and high school students. Tabby.
I know I've got like tons of questions.
No, that's
and
fine.
this is totally might be off topic, but does Lysol really kill bacteria like on door handles?
Yeah,
and surfaces?
it really does. Just let it sit for a little bit. Don't spray and wipe off. Give it time to work. Give it time to work. But it does. It kills bacteria, kills viruses. You can use Lysol. I do. It does. It does. Lysol works.
Just the size, since the mycoplasmas are so small.
They're so
the
small.
smallest.
They are the smallest
Does-
type of bacteria.
Right. Is that part of the reason why this is walking and doesn't really push down hard?
No, it's called, the reason why it's called walking pneumonia in terms of the symptoms, but the symptoms are not all that severe to really take you out. That's why.
So it's not an issue of the size of the bacteria?
No, it has nothing to do with their size, but that's a good line of thinking though. It basically deals with you have pneumonia, but you're not in hospital. You can treat it with antibiotics, but really prevention is difficult because a lot of people are asymptomatic, which means they have Mycoplasma pneumoniae and they're walking around with it. And sometimes their symptoms are not all that severe. They don't realize they're sick. They may think they have a cold or something. So really it's difficult to diagnose if they never go to the hospital. And they end up spreading it to all their frat brothers. Here's a quick picture of